All right, here we go. All right. Hello, everyone. Today we have a very special guest, as are all of our guests, but the guest today is Diane Poilly. I hope I got that one right. And she is a doctor that supports us at Carefor's Hospice in Cornwall. So welcome.
Thank you. It's a pleasure to be here.
Thank you. So first, we're here today to kind of talk a little bit about vaccinations, talk about COVID, and to get your professional opinion on the subject. But before we go into that, maybe you can just give us a little bit more information about you and what you do to support us at the hospice.
So at hospice, I'm the medical director of hospice in Cornwall, and I provide palliative care in the homes of people. I follow about 50 patients actively at one time. From a vaccination point of view, which is not particularly Carefor, but it's for the world, I think, is I was doing vaccination clinics on a weekly basis in the mass clinics. Currently, the mass clinics are down or smaller, but they probably will be picking up with the youngsters coming to get their vaccines as well now. But
Sure.
that's basically my inkling on vaccinations. And in the past, I was in emergency for 18 years. So being on the front line, I really feel for these people, and having gone through SARS and wearing the N95s and all of that discomfort and seeing that. And Cornwall was particularly hit hard for SARS.
Right. Okay. So you definitely have frontline experience with, not only the current reality that we're living in, but where it's come from and previous experiences. So that's great. Great for us to learn from your knowledge. So before we go into talking about the vaccinations and the rollout and all that kind of stuff, maybe we can talk a little bit more about the disease itself. Can you just give us a little bit more information about COVID-19, how it affects the body, things like that?
So the disease per se hasn't really changed over the year and a half. We've had to learn what that disease is, and it wasn't typical of any prior viruses that we'd had. It was similar to SARS in some ways, but not in others. But the disease hasn't really changed that much. What has changed is the demographics of who it's affecting. So, today it's affecting the unvaccinated and therefore usually younger people. And that's always very devastating when a young person suffers from it and, gets admitted and goes to ICU for 3 months and, the long-term effects of it. But the disease per se hasn't really changed. It's a virus. Viruses are very good at mutating and changing just slightly so that even if you had it before, you can get it again, just slightly different, a bit like a cold. So that's our challenge with it versus it being a bacterial disease, which is generally quite severe, but easy to treat. So that's the big difference with COVID.
Okay. And so in those mutations, you're describing it as being something that is affecting different people now. So in the early days of COVID, it seemed to be sort of very much kind of having the greatest impact on older people. Whereas now it seems to be sort of affecting, younger people. How have you seen, and is that accurate, or have you seen basically those affected changing, and why is that, if that is in fact the case?
Well, of course, the first people to get the vaccines back in early 2021
Right.
were the long-term care people. And actually, we're boosting them now because their immunity is waning a little bit. And now we are seeing a little bit of outbreaks in the long-term care residences, and that's starting. But it's really the vaccination that made it change, right? They became vaccinated, and as the vaccines became more and more available, and the more vulnerable people became vaccinated, and the younger people got it. So, so really now everybody has been eligible from the ages of 12 on to get their vaccines. And so now you've got kind of two groups. You got the vaccinated ones, and then you got the unvaccinated ones. And really now the people in hospital and the people dying or prolonged ICU admissions and really suffering from it are the young people, which affects our society probably more, in the workforce, school force, all that stuff. But yeah, so it's really changing in that way.
Okay, we'll talk about that in a little bit more in a second.
And
Yeah.
the other effects are getting tired, and people.
Sorry, say that again. I think my internet is lagging.
Okay. Well, you said we're going to get into that later, I think.
Oh yeah, yeah. Well, and I mean, yeah. So to get more into like the COVID vaccination or the vaccine in a little bit, but in general, you know, the COVID-19 vaccine is not the first vaccine that we've seen, and historically, vaccines have been something that we've used to either protect us, and in very few cases, sort of to eradicate certain diseases. And flu shot is something that we've experienced year after year after year. Maybe talk a little bit about vaccines historically speaking, and kind of what science goes into the creation of vaccines, and maybe specifically around the COVID-19 one in this particular case. I know, kind of a massive question, but just to it's not like we're just pulling the COVID vaccine wasn't just pulled out of nowhere. You know what I mean? That there was a history of vaccines and vaccinations to support people in their health.
So overall vaccines, okay, has changed the world, right? People, how many kids used to die in the world? We're looking at globally in the world, how many kids would die before the age of 5. Vaccinations made a huge, probably the biggest difference was vaccines of childhood diseases. The COVID vaccine, so we've had vaccines for, trying to remember if Pasteur was in 1850 or so. Anyway, he was the first one with rabies. I don't know if you remember that, but so they've been around, let's say, for 100 years, but I don't quote me on that. I'm not sure, actually.
Okay.
So vaccines have really changed the face of the world of human species versus viruses. Most of these diseases are viruses. The COVID vaccine is a slightly different technology, which is even better, and it's the most studied vaccine of all of the vaccines, right? So many people participated in studies. We had so many sick people. There was so much money. It is incredibly studied. There's nothing more studied than COVID right now. So it's an incredibly safe vaccine, and it works slightly differently. It gives you, what's injected into you is the recipe for that spike protein, which is the spike protein is just that key to attach for the coronavirus to attach to your cells. And with that key, unlocks your cell, gets into your cell, then reproduces and becomes billions of coronaviruses. But it's just the key. The key per se does not give you the disease. So what the vaccine does, the mRNA vaccine, it gives you the recipe to create just the key. Your body itself makes the key, then the body yourself makes the antibodies against it. So when you do see the next key come in, because you're going to get SARS-CoV-2 is going to come into your body, like it's a question of time before it happens. So it will come into your body. Your body, those soldiers that you've made, will recognize that key and attack that key at the beginning of the disease when there's very few cells with it.
Right.
And therefore you never develop the symptoms, or if you do, you develop very few symptoms and you don't get incredibly sick from all that reproduction of the SARS-CoV-2 in you. So that's how that works. So it's an incredibly safe vaccine. It's a beautiful vaccine. It really, the way it works, it's amazing. It's been used for 10 to 20 years in targeted cell therapy for cancer. As a chemotherapy, it's a very specific vaccine treatment for cancer, and it's been working really well. If you have the cancer with that specific target that they have, then you're actually quite lucky, because there's a specific target therapy. So that's how this vaccine works. Now, with time, and what we've seen is that their immunity wanes over time. It goes down a little bit now. So, elderly people now, we're seeing that we need to, elderly in long-term care and other specific populations, we need to give them a booster shot. So that likely is going to continue until the disease per se globally is under control, hopefully eradicated.
So, okay, so let's go there. As far as the eradication of the disease, we talk about herd immunity. We talk about, the number of people getting vaccinated to reach a certain level and the number of people who recover from it. What do we need to do to get to that place of eradication?
Okay. So first of all, it is a global disease. right? It's SARS-CoV-2 against human species. So human species around the world need to be vaccinated, fully vaccinated, all kind of at the same time, right? Everybody has to be vaccinated. So until the globe is not fully vaccinated, it's not going to happen. When is that going to happen? 2022, 23, and that's if everybody accepts the vaccination.
Right.
Herd immunity is 95+% of the population fully vaccinated. We've got about 25% of our population that are children. So we're not there yet, right? We can't be there because we can't vaccinate the kids yet. Well, that'll come, but before the end of the year, we'll be able to. Then the issue is going to be, distributing it to the world and getting everybody to be vaccinated. And until that happens, unfortunately, this disease is going to be with us.
And so when you say with us, I mean, that's the measures that we're sort of currently enacting: social distancing, vaccinations, passports, masks, all of that kind of stuff. So this reality that we're living within, is going to sort of exist. It's not like, well, I'll show my 2 pieces of ID or my vaccination passport at the restaurant until whatever spring, and then everything's going to be good. You anticipate this becoming a norm for a while?
I'd say at least another year. Yeah. Just because we need the globe vaccinated.
Right. And so as far as, go ahead, say again.
Well, and the other thing is that if you've got, let's say in Canada, where everybody is eligible and the vaccine is free,
Right.
if you've got, 20% of the population not being vaccinated, it's not going to happen until those people get vaccinated.
And the concept of, herd immunity, or that they get the COVID or they get COVID and then recover from it. Is that an aspect of it, that they have to, the unvaccinated people have to get COVID or not?
Yes, no, well, yes and no. So if you get COVID today, you will be immune for up to 3 months.
Oh,
So it's not a lifetime immunity.
right.
So it's 3 months. And the stronger the disease, the stronger the immunity, but it's still 3 months. So getting COVID is not going to be a long-term benefit. Well, it's definitely not going to be a long-term benefit as far as the vaccination goes, or how it's going to affect you. When you think of, 25% to 30% of people have long COVID, that's a death. Well, it's a curse, on that.
So
Sorry, we went into something else there.
Yeah, I know. And I mean, it's fascinating. And I don't get too many opportunities to speak to an actual, doctor about these things. So I'm kind of going off script, but, because I have all these personal questions that I want to understand. So part of it is, if somebody, you hear people getting COVID and it's kind of like, well, it's just a bad cold or whatever the case may be. And then you hear stories of like a 25-year-old in ICU on, lung support machines. Why is it that, sorry?
For 3 months.
Exactly. So why is it that some people are more affected by the disease than others? Is it their immune system, or is it the nature of the particular virus that infected them?
I think there's a bit of both. There are risk factors that make you more susceptible, obesity being the one really important one in the younger population, age, of course, and then if you have any chronic diseases or immunosuppression for any means, you will be at higher risk. But there are some people that just get it, and it just seems to be bad luck as to why they were more severe than their neighbor with the same conditions. And that can't be explained yet, but unfortunately, there are many of those, and that's sad.
Well, and part of it also is that, from my understanding, being vaccinated doesn't necessarily stop the virus from attaching itself to a person. It just, it stops that person from getting sick. And so if I'm vaccinated or not vaccinated, the virus can attach itself to me. And therefore, if I come in contact with somebody who's not vaccinated, then I'm bringing that virus to that person and thus causing them risk. So that's the idea of this the collective nature of how we are acting in response to this. It's not a matter of like, well, I don't have to wear my motorbike helmet because I'm the only person being affected. It's that idea of we are we are interacting, and so the idea
We're
of
in
the
this
passports.
together.
Sorry, say it again.
We're in this together. I mean, what you do affects me and what I do affects you. Yes,
Right. And
absolutely.
so the idea of the vaccination passports and restricting people being able to mingle between people that are vaccinated and unvaccinated, is that sort of generally the idea there?
Yes. So let's say you're vaccinated, fully vaccinated. So you've got your soldiers that you've made that are going to attack a spike protein when it comes into contact with spike protein. So you are in contact with the disease, which we are all have been or will be or are. We're going to be in contact with the disease. The disease comes in, you vaccinate it, go and attack it, and then you will get it. You'll get a response very early to that disease and, kill it. That's the idea. But the vaccine doesn't say you are not going to get sick. The vaccine says you will not get very sick and require going to the hospital or dying from the disease. It doesn't not going to get COVID. It'd be much more in your system. You have a cell that you've got this virus in you, it will go in your nose and you can give it to whoever's around you, whether they're vaccinated or not. It's going to go into the person. But the person who's next to you who's vaccinated, again, they're going to attack it, those early SARS-CoV-2 cells. But the unvaccinated person, once that SARS-CoV-2 goes in, they have no soldiers. So it takes them a few days to mount an immune response. In the meantime, their body has, their SARS-CoV-2 has multiplied so many times, they are very infected, they've got virus all over, and they become even more contagious. So vaccination does not protect you completely.
Right.
You still need to wear a mask. And this idea of having a vaccine passport and going into restaurants are dangerous, right? Because you're taking off your mask, you're eating, and that's always a bit weary. But if you're surrounded by people who have soldiers, it's much more reassuring than somebody who's eating next to you, has no soldiers, has a lot of virus. That's risky.
Right.
So it's I'm protected, you're protected. It's not risk-free. It is not. But the chances of you getting sick and going to the hospital are much lower.
Right.
When let's say everybody gets vaccinated. Let's just dream for a moment.
Yeah.
Everybody's vaccinated. Okay. So there's a SARS-CoV-2 going around and it's attacking people, but it's not getting very far, right? So it doesn't reproduce very much. And these mutations are formed by reproduction. The more it reproduces, let's take India, for example, it was chaos there. It was reproducing at an alarming rate. Right. And when it reproduces like that, every time there's a reproduction, you can get a genetic change. That spike protein can change a little bit. That's what it wants to do. That virus wants to change that spike protein so that it can attack those vaccinated people. But if you got lots and lots and lots of changes, lots of mutations, that's when you get that Delta variant. But if we could get everybody vaccinated, there will still be some transmission. There's still going to be some,
right,
but not enough to create those mutations. And then we can
stop it in its
breathe,
tracks.
and it's not going to mutate. And then we're looking at the light at the end of the tunnel. But there's no other way. There's no other way, unfortunately.
Well, I think that's it partially. Like, nobody wants to have a vaccination passport. Nobody wants to have to show it in the restaurant to people. And, I think that, personally speaking, I understand that if that's the way out of this situation, then okay, I will get vaccinated. I will show my passport. I will do those things. If that is, based on the science that you're talking about and the people that are obviously engaged in doing it, if that's the door, then that's the door, right? And, if the alternative becomes, months and years and no end to this, then it becomes kind of a, well, what can we do? And I guess that becomes sort of it to a certain extent, is what are the actions that
restaurants are going to be.
Yeah.
And as human beings, our social interactions are generally based around eating. We eat together, right?
Right.
That's how we socialize. And if we can't get vaccinated, there are no restaurants. We cannot eat together. Right. But you, as a vaccinated person and showing your proof, do you not feel better knowing that everybody else who's taken off their mask around you is also vaccinated?
Yeah.
Like that makes you feel better too, right?
Yeah. Yeah, and
So,
helping businesses be able to continue to operate, knowing that, the thing that was shutting them down was just the lack of vaccinations. Anyway, we could talk
yeah.
about this for hours. I really appreciate your time and your insight. It's super, super helpful. Yeah, so I mean, Carefor is doing what we can to sort of be a part of the solution. So, and thank you for helping us with your knowledge today. Much appreciated.
And if anybody has any questions or wants to talk to me personally, here's my cell phone number, 613-662-3307. So 662-3307. You can email me at dianepoilly@yahoo.ca. So Diane with one N, Poilly, P as in Paul, OILLY @yahoo.ca. And if you have any questions about vaccination or anything related to COVID, I'm quite happy to be of assistance to
Awesome.
anybody.
Super, super helpful. Much appreciated for that. Much appreciated for your time and all your work at the hospice.
Okay, take care, Trevor.
Thank you. Thanks, Diane.